we were in the old chamber. How many of us missed the old chamber? But we're here, and therefore we're relying on protection of our voice in order that people can hear us. But equally well, with a central microphone, there isn't the opportunity to turn it off and sort of confidentially talk to the person beside you or whatever. So this will pick up every sound that you make will be broadcast to the world. So just worth keeping in mind. It's fantastic to see everybody here, and I'll just move on to the agenda. Yeah, so we're going to note item number 1 of the agenda, which is the appointment of the chairman of Nottinghamshire Health and Wellbeing Board, and that is myself, John Doddy. And I have to say that I'm no stranger to the board. I came here in 2011, and I've been involved in the board probably every year since then, in 2 of the health and wellbeing strategies. So I've probably been involved in the board since they were created by Andrew Lansley in his Health and Social Care Act in 2012. I probably haven't missed very much. Although, to be fair, I haven't been involved for the last 6 months or so, when there has been quite a significant change in the activities of the board since I've last been here. So it's quite important that we recognise that the Local Government Association, working with the Health and Wellbeing Board, have changed the way we carry out our meetings, how we set our priorities. A small number of priorities being dealt with in a really good way is far better than a large number of priorities that are out there. The other changing landscape, obviously, is the East Midlands Combined Counties Authority, which is going to get bigger and bigger. It has to be said that health and wellbeing is not reflected on that board yet. It's a board that is mainly transport and economic and development, etc. But as everybody on the Health and Wellbeing Board knows, houses, jobs, homes, travel are the building blocks of a healthy community. So one way or another, we are involved in it. The other changing landscape is what's coming over the hill is local government reorganisation in the next 2 to 3 years. 2027 to 2028, there's a very large likelihood that significant portions of the current boundaries as we know them may change, and therefore our responsibilities. Colin's laughing over there. He's probably as knowledgeable about it as I am. Nobody knows what's going to happen, Colin, so we'll keep an open mind on that. In terms of our Victoria McGregor Riley down there and our interaction with the ICS and the ICP, and the ICB in the place-based partnerships and primary care networks right down to the patient in their own home. There are huge changes in the ICB with requests for a 50% reduction in ICB, etc. And that is underway at the moment. So there are massive changes occurring all around the place, and we don't know exactly how well they will interact with what we've got to do. I was particularly interested to come back and find that public health had been moved into place. Now, some of you may be aware that public health pre-2020, pre-2012 was a medical speciality where you qualified as a doctor and you went into public health. Prior to 2012, every single public health doctor existed within the NHS in hospitals. Andrew Lansley will move public health first into the county, showed that that's where it was. And Vivian, the director of public health here, now has moved it front and square into place and into communities where its real home is, and where we're likely to see the greatest activities. We've got a very packed agenda today. Since I've been away, I think one of the things that I picked up on and that is of concern is largely around vaccinations. One of the things that's going on out there is a steady vaccine hesitancy. We're seeing people not pick up the measles vaccines and get outbreaks of measles in places like Birmingham, deaths from diseases that have been eradicated in the past, and we have been declared measles free. We've seen declines in HPV vaccination. We know that if we continued along the line of vaccinating everybody, we could actually eradicate cervical cancer from the map. So the last disease that was eradicated by the human effort in the entirety of the world was smallpox in 1979. So we're not very good at eradicating diseases, but we have got vaccines, and all the things we try and do fail if we can't implement the things that are already in existence. So it doesn't matter what we come up with, we can't get people to vaccinate the kids. If we can't get people to take up the offers that already exist, and there's a new one coming up now for gonorrhea, Neisseria meningitidis, which has been trialled in Northern Ireland. But one of our tasks really is not only to be the purveyors of information, but then somehow improve our communications to the population so that they believe and trust in the things we're doing. And I think that's got to be the mantra going forward, is to involve people at each and every level. So I look forward to what's coming forward, and the next item on the agenda is the noting of the membership of Nottinghamshire Health and Wellbeing Board. That's item number 2. Bring to your attention. Item number 3 is the minutes of the last meeting. So the minutes are for noting only, commenting on or factual correction, but should not lead to a discussion about any items that exist on those minutes. So I'd ask you just to look through the minutes. Read. All in favour of the minutes? Yes, I'll take that as a tacit approval. We'll call it tacit approval, James. Apologies for absence. Have we got any apologies, James?
Okay, so Chair, we have apologies from Natalie Baker-Napier, Dr. Dylan Bartholomews, Councillor Susan Crosby, Professor Daniel King, Jill Langridge, Councillor Jonathan Wheeler, and Melanie Williams. We do have attending as substitutes today, Katie Ball for Melanie Williams and Councillor Abby Brennan for Councillor Jonathan Wheeler.
Excellent. Item number 5 is declaration of interest by members. If any member here present has any pecuniary or non-pecuniary interest in any of the items on the agenda, now is the time to put up your hand and declare such an interest. If you realise during an item that you've got an interest in it, I'll interrupt us at that time. Anybody got any interests they wish to? No. Hang on. Councillor Wilmot.
I think I ought to say that I'm actually on the committee of the Wyvern Medical Practice. Although I don't make any decisions, all I do is represent the people that at the surgery.
Like a patient.
Patient
representative. Yeah. The patient participation group.
I just correct it. The Wyvern Medical Practice.
Yep, fantastic. Excellent. Now I'm going to go over to the Director of Public Health, Vivian Robbins, to introduce the roles and responsibilities of all of those people who are on the Health and Wellbeing Board.
Thank you, Councillor Doddy. So welcome to a range of new members around the table, acknowledging that this is the first Health and Wellbeing Board of this school year. So what we just wanted to do was just really to have a bit of a quick update in terms of what the main roles and responsibilities are of the Health and Wellbeing Board, and some of the things that we've worked through over the past year in terms of thinking around how this board will work moving forward, particularly for those members that may not have been able to go to the induction or maybe new to the board. So in terms of the statutory roles and responsibility of the Health and Wellbeing Board. So this is a partnership board and rather than a governing body. And our key purpose here is to think around what we can do as a collective to improve the health of the population and to reduce health inequalities. What we're really keen to develop, and it's some of the work that we've developed over the past year in terms of through the Local Government Association review, is really think around how do we utilise everybody's role in this board to really make health and wellbeing part of everybody's business, and really think around how you can champion, advocate and lead for those health and wellbeing agenda items that we talk about inside the room, but also outside of the room in your organisations and in your wider roles. In terms of the statutory responsibilities, so I've mentioned in terms of the role of improving health and reducing health inequalities. There's also a statutory role around promoting integrated working. And then there are some statutory products that we have to deliver in terms of the joint strategic needs assessment, so that broader needs assessment around understanding the needs of our population, and the joint health and wellbeing strategy, which Councillor Doddy has mentioned already, which is really about articulating our shared vision around how we want to improve health and wellbeing for Nottinghamshire. And for those of you that haven't seen it already, we can make sure that those links are circulated. In terms of the function of the board, we recently agreed and committed to some operating principles as part of the Health and Wellbeing Board Compact. Hopefully many of you will have received those in terms of your introduction and guidance to the meeting. And what those were really aiming to do is thinking of how we establish shared agreement and understanding around how we want to work within the board, building on some of the best practice evidence that the LGA has provided for us, and really think around how we move the board into that role around really having impact across Nottinghamshire. So what can we do as a collective that is above and beyond what we would do as our individual organisations? There were some key principles within that about having a true strategic partnership approach and making sure that our approach is a collective endeavour, and that is very distinct to the role of health scrutiny. So if there are areas that we feel that need to be scrutinised, we can absolutely have those conversations with the health scrutiny chair, but being really clear that this isn't a board about scrutinising performance. This is about how do we support each other to really drive and deliver some impacts for Nottinghamshire in a way that we wouldn't be able to do individually. There were some really key messages around parity across the membership, and that we are all equals within this board, and to ask members to respect that and consider that as we're working together, and really think around their proactive role in championing the work of the board. And so really coming back to the work of the board is what we do outside the room, not necessarily what we do inside the room. And we will be talking around some of that in terms of some of the workshops this afternoon. But if you would like any more information, I won't go into too much more detail today. What I'd really advise you to look at is there's an introductory presentation and sort of training set that hopefully you will have received. If you haven't received that, you can let me know and we can absolutely get that over to you. And please ask you to just refresh your mind in terms of what we agreed in terms of that compact and those working together principles. Because we know that if we implement these effectively, then we will make the best use of this time and really have an impact. That's all I wanted to cover on that, Chair.
Yes, I'll open it up in case anybody's got any queries about anything new that's occurred, anything that hasn't occurred, anything you'd like to occur, anything at all. Nope. Fantastic. So we're going to move on now, and I think it's a good time just to say that this is a hybrid meeting. So at around 2:45 we will be breaking up from here. As long as we keep to time, we'll be going through into the assembly room and we'll be having a workshop on women's health. The first part of the meeting will hopefully get finished, as I say, for 2:45. There'll be tea and biscuits available, and then, as I say, short break, and then we would anticipate finishing before 5. Now, one of the very interesting things is the Health and Wellbeing Board has never run from 1 o'clock to 5 o'clock in the history of Health and Wellbeing Boards. I'm going to give thanks to Director of Public Health here for that wonderful improvement in the.
It was a collective decision.
A collective decision. So we could have a long hot afternoon, but we're going to see how it goes, and we're going to learn from it positively or negatively. The afternoon exists in the form of the various papers that we're going to look at and the various reports. And the first one is one that directs the workshop, which in a few minutes will be the annual director's report on women's health. But then I would also like to say that the next 3 reports, which are report 8, 9 and 10, all focus on giving children the best start in life and the best start strategy, and they're all interwoven. So although there's 3 reports, we will present them as a single report, and then after that we'll do the Better Care Fund and the work programme, hoping, as I say, to finish by 2025. So what I'm going to do now is to move on to item number 7. This is the annual Director's Report on Public Health and Communities Report. And the Director of Public Health has chosen to focus this one particularly on women's health, bearing in mind that women make up something like 51% of the population and men make up 49% of the population. I'm waiting for a report next year on men's health. I might have to lead it myself, but for today, it's on the complex relationship between the length of time people actually live and the length of time they actually live in good health. And with that, I shall pass over to the Director, Vivian Roberts.
Thank you, Chair. So thank you all for your time this afternoon. So what we're bringing with you today is the Statutory Director of Public Health Report for 24 and 25. What we want to do is inform the Health and Wellbeing Board around what this report is, and then as Councillor Doddy has mentioned, we will then go into the detail and really unpick how we can support implementation of the recommendations. But what you'll see in the papers that you've got is that we've done a combination of a written and a video report to try and have as much reach as possible. Because the Director of Public Health report is a statutory report which is independent from the council, so it's an independent report from myself, but it is obviously published on the council website. And the aim of this report is, and of reports from previous years, is to put a spotlight on an area of health and wellbeing that we think needs a little bit more understanding and discussion around. And the reason why we've specifically looked at women's health for this annual report, yes, because of the significant proportion of the population, but also specifically because we know that in Nottinghamshire that healthy life expectancy for women has been declining for a number of years. And although we're similar to the national average, we're actually decreasing at a rate faster than the national average. So we know that the healthy life expectancy, so the number of years of life in good health for our women, is now under 60, which is the first time we've ever seen that. And is going in the wrong direction. And there's something specific around our women in Nottinghamshire that is different to the national average. So that was really why we wanted to put a spotlight on it and do a little bit more digging, really engage with our women and our population to really hear their voices around what it's like being a woman in Nottinghamshire, to really think around how we can then add that equity lens to the work we're doing, to really think around how we can improve some of those outcomes. But if I may, Ellie Story, who's joining us today, has done a lot of the legwork on this. And so, Ellie, if it's okay, can I pass over to you to take us through some of the key highlights of the report? And then we will obviously come back to it again in more detail this afternoon.
Absolutely. Thanks, Viv. So as Viv said, I'm Ellie. So I've been leading a team of very passionate and fantastic staff working on this report over the last few months. This has been a labour of love and a series of a real kind of mixed methods piece of research on this. So we've looked at both qualitative and quantitative data. So we did a big survey that had more than nearly 1,000 responses, which at its time was the most responded to survey of all time in Nottinghamshire County Council. It has since been superseded, but it's really fantastic to see that response from our residents. We also had a series of interviews, semi-structured interviews with residents, with women who were underrepresented through that survey. So survivors of domestic abuse and violence against women and girls, those who had been in touch with the criminal justice system, those who had severe mental illness, and a few other kind of vulnerabilities that were underrepresented that we wanted to make sure that we'd heard their voices through that process. And we also then looked through a plethora of data. So we utilised some of our national data sets, but also some of our ICB, GP data sets, and lots of different quantitative data to understand and start to piece together some of the bits of the puzzle around why are our women in Nottinghamshire living in ill health or losing more years to ill health than in other parts of the country and compared to their male counterparts. So I don't want to do too much talking because I'd like to show you the video of the report, and hopefully that will give you the information you need. We'll also be going into more detail this afternoon. The purpose of this session is really just get your endorsement and your support for this report, and to say, you know, this matters, and this is all of our responsibility, because what you'll see in all of the themes is that they are highly cross-cutting. No one individual part of us is going to be able to fix this problem. So there's lots of things that we need to think about how we do this together. The purpose of the session this afternoon, which myself and Viv will be leading, is around how do we flesh out a bit of an action plan of the so what do we actually do about this? Because you'll see that the recommendations are fairly high level, because they have to be. But hopefully what we'll do is start to get into a bit more of that nitty gritty this afternoon. We'll be joined by a large group of broader stakeholders from across the system this afternoon as well. So I'm going to try, tech pending, and show you the video. So bear with me 1 second, and then hopefully we'll have time for any kind of questions or comments at the end of that. Hold music.
Hello, I'm Vivian Robbins, and I'm the Director of Public Health and Communities for Nottinghamshire County Council. This is my first annual report, and I'm using this opportunity to shine a light on women's health and the inequalities that our female population are currently facing. Women in Nottinghamshire are living longer than men, but spend more years in ill health. We've heard from many women across our county, and I would like for you to hear their voices too. In Nottinghamshire, there are over 430,000 women, making up to 51% of our population. Our women have a higher rate of disability than the national average across all age groups. The main causes for this are musculoskeletal conditions such as back pain, mental health disorders, and gynecological conditions such as endometriosis.
The main issues that I've seen amongst women in my life have been things like PCOS and endometriosis, and I know that for a lot of the women that I've spoken to who've had these issues, they've taken a really long time to be able to even have that label and to get the help that they need.
I have met so many different people in the seniors club that we have coffees with here that have got similar issues to myself, either mental health or spine problems or arthritis problems.
Improving healthy behaviours for both women and men would have the greatest impact on early deaths. This includes reducing smoking and vaping, improving diet, and increasing exercise. While progress has been made in reducing the number of people smoking in Nottinghamshire, reducing smoking during pregnancy remains a key area for improvement.
I would like women to have access to whatever they need to give them healthy years and for their lifespan to be at their maximum.
Access to contraception continues to be a key priority at a time and location convenient to women. Further work is required to support women to prevent unplanned pregnancies. Almost all women will experience menopause, where symptoms can severely impact on women's quality of life. Our research found this remains a taboo subject in Nottinghamshire, and there are inequalities in accessing treatment. We need better education on women's health conditions and understanding from employers.
So the menopause while working, wow, for me, it's been an absolute emotional roller coaster.
Women's voices are another crucial theme. Many women in our county feel their health concerns are not adequately heard or addressed. Our women describe feeling fobbed off and fighting to be heard.
So I don't really blame the healthcare professionals. They're trying to identify ways to tackle that issue, but at the same time I do think that I could have been treated with more empathy, and instead of perhaps being told that it was all in my head or it was just something that I would have had to deal with.
It is imperative that we listen to and validate women's experiences to provide comprehensive care.
It just seems like you're just a number. You've had it done, we'll get you out the door.
We really need to take the time to listen to what the women in Nottinghamshire need and what it is they want to change.
Poor mental health was a prominent issue for women in Nottinghamshire. Anxiety and depression were the most common health conditions in women under 50 from our survey. We must prioritise mental health support and reduce the stigma associated with seeking help.
Then she referred it. She thought I needed long-term counselling. And I'm still waiting for the referral, and that's 5 years this August.
Access to healthcare services remains a significant challenge for many women. Our survey reported 43% of respondents experienced barriers in accessing services, such as delays when needing to see female clinicians. Marginalised groups, including refugees, people seeking asylum, people who identify as LGBTQ+, and survivors of violence and abuse face additional barriers in accessing healthcare and support. They also experience poorer health outcomes than other women. It is essential that we address these inequalities.
I now generally choose to be seen by female clinicians because of my experiences of not being listened to.
There are several health conditions disproportionately impacting women later in life. Evidence suggests that women in Nottinghamshire are frailer than men and have a higher rate of hospital admissions for falls. We know many falls are preventable, and we are working together to address this across the health and care system.
Yeah, I think when you retire as a woman, you've worked all your life and you want to really, really enjoy your retirement, and it would be great to be fit and healthy to do that.
I've seen more of my friends navigate illnesses at an earlier age, seemingly more common.
The building blocks of health play a vital role in women's health. Lower educational levels, financial instability and community safety for women in Nottinghamshire are significant concerns, and we must work to improve these foundational aspects to support overall health and wellbeing.
I generally feel very safe in Nottinghamshire, but I don't feel safe walking on my own after dark generally.
I think that there's many things that contribute to people being in good health. From a non-health perspective in particular, having financial security, having good support systems, and being able to access and speak to the people that they need to when they do need help.
We recognise this work is just the beginning of our journey to supporting women's health. Through hearing these stories, we have developed recommendations to improve the health and wellbeing of our women in Nottinghamshire. Let me hand over to some women of Nottinghamshire to share these recommendations with you.
We and our partners have created a list of 10 recommendations to help improve the lives of women in Nottinghamshire. These recommendations are all of our responsibility to help drive change and reduce the number of years that women are living in ill health in our county.
Our first recommendation is to have a system-wide commitment to women's health from the Nottinghamshire Health and Wellbeing Board. This will ensure that we have a partnership approach to addressing the issues raised in this report.
Our next recommendation is to work with our place-based partnerships and communities to identify areas of the highest need, so that we can work together in partnership to address inequalities.
Following our findings that so many women do not feel listened to, we want to ensure women are listened to more. Our recommendation is that we want to give women a voice and say in how their health is supported.
Women and girls' challenges with mental health has been one of the key findings of this report. We recommend working together with our partners to investigate what the barriers are for women to access support for their mental health and improve our signposting to offer support.
Our next recommendation is to continue to work with partners to reduce the rate of smoking in pregnancy in Nottinghamshire, and to work across the system to help women and girls to feel safe to exercise outside.
We heard from many women about their experiences of health in the workplace. Through our work and health programmes, we need to work together with our partners to understand how we can further improve this and keep women in the workforce.
Our next recommendation is that we would like to ensure that healthcare services are trauma-informed and take an increased role in early identification and support for survivors of abuse and violence.
Our recommendation to support marginalised women is to develop a framework for women experiencing severe multiple disadvantage to identify areas of good practice for women and areas for improvement.
Our next recommendation is to build upon the existing commitment in Nottinghamshire to use the principle of making every contact count. We want to ensure that our healthcare professionals are provided with the appropriate training, skills, and enabling environment to have conversations about women's health and to support women to access the right care when they need it.
Our final recommendation is designed to support women in Nottinghamshire to age well.
We will do this by investigating early deaths associated with colorectal cancer in our county, understanding the impact of musculoskeletal conditions on women's frailty, and continuing to investigate the gaps in data around women's health that we have found during this project.
Together, we can create a healthier future for all women in Nottinghamshire. Thank you.
Thank you all for your time listening to the video. And I really want to say a really big thank you to many of the people, including women of Nottinghamshire, who have supported the work to pulling this report together, whether that's through the survey, whether that's through the analysis, and whether that's through participating in the video. Thank you, Ellie, for leading the team on this. So that leaves us down to the recommendations, really, Councillor Doddy.
Yes, I moved the recommendations as on page number 16, recommending to consider how they can be collectively supported. The recommendations and how recommendations can be forward or include wider partners within the partnership forums to the widest possible reach. They will be the recommendations we move them, but I'm going to open it approve that. We've got a certain amount of questions. It was delivered, Ellie, yes, with a great deal of satisfaction of getting across exactly what you want to get across. And I know in particular with endometriosis, I had a professor giving a talk on it. And he said this disease is as important as an inflammatory bowel disease like ulcerative colitis or Crohn's disease. That's how important it is. It's an inflammatory condition that affects the whole of your body. And I said, that's great. But he then went on to say that I want you to make the diagnosis based on the symptoms that you've got in front of you and just treat it empirically based on how you assess that person. Yet they would never diagnose got a colonoscopy, but they want GPs to diagnose endometriosis without a laparoscopy. Largely down to the fact that they haven't got anybody to do the laparoscopies, and largely that they want to cut down on the waiting list. So they talk about making these diseases equitable, but their actual management of them is anything but that. And that's the one that we're up against in trying to make these type of diagnoses. There's some great work going on in this actually at Forest Hospital around smoking and pregnancy, and I've seen that pioneering project myself and its outcomes, and how they actually treat not only the pregnant woman, but actually have to treat the partner for smoking as well and the family for smoking in order to reduce all of the factors that are around the person. You know, if you're trying to lose weight and your partner's eating a whole bucket of custard creams, sometimes quite a tricky thing to do. It's funny that contraception is a big issue, but at the same time, for the first time in history, we have a falling birth rate. So it's a slight juxtapositioning of those two things together. And it seems that long-term counselling is defined by a long-term wait. I'm going to throw it over, and the first hand up was always Councillor Weezer.
Thank you, Chair. Thank you for a really good report as well, actually, very good. I just wanted to ask a couple of questions really related to the recommendations. So on page 25, it's recommendation 4, 5 and 7. I just wanted to know what the local authority will be doing in terms of looking at trauma-informed practice with partners like, for example, Equation. So, for example, I work with young people. I was just wondering how you was going to sort of bring the mental health bit, the health behaviours bit, and violence against women bit in together in terms of trauma-informed practice, particularly with schools, colleges across the county. The other one was related to carers in terms of unpaid carers. I was just wondering what sort of support will be recommended into what recommendations will put place to help unpaid carers in terms of the sheer volume of work that they do, which without a lot of things wouldn't happen with this country. Thank you.
Thank you, Councillor Wheeler. Before you answer that, a lot of hands went up and went back down again, but I've never seen anything. Are you keeping an eye on these things?
So, yeah.
Councillor Sally too. Yes, I'll pass. Who wants to actually answer that? Let's Lucy,
Chairman.
Ellie, or Vivian.
Chairman, can I just say something? We back here mainly can't hear.
And I did warn that right at the very beginning, down to the projection of people's voices.
You have to shout.
I'll have to shout. I'll have to walk over to you.
Shout or sit in the middle.
We've only got that little tiny microphone.
Useless.
Absolutely useless. Yes, but we're stuck here in the.
Perhaps you should sit more to the middle where your voice will go out both sides. We can't hear here.
Okay, apologise. Right, we're going to go back to the beginning again. Go on, Councillor Vivian. Do your best.
Yeah, so in terms of some of these questions, we're going to have a more detailed session this afternoon. So we can get into the absolute detail of what that means. And so if you have got specific questions around that in terms of detail, if I can ask that you hold them for the next room, because I think we're going to have a longer time to get into the detail of that. In terms of from a county council point of view, so the county council has already endorsed the voluntary strategy early on in the year. And as part of that, that also includes elements of our trauma-informed approach. Trauma-informed approach is also in the integrated care strategy and elements within that. So it's work that we're already doing. But I think what I'm trying to do with some of this work is think around how can we turn up the volume on some of these areas, or how can we do things in a slightly different way that will improve outcomes for women in a way that we might not have thought about it. So again, the carer strategy, and Katie, you're very involved in the carer strategy. That's fairly recently been updated. And Katie, I'll let you confirm when that was. But we have looked at what the offer is for our carers, because we know that our health outcomes for carers are not where we would like them to be. So if it's okay, can we get into some of the more detail in the next room? Because we've also got broader colleagues who are working on those agenda areas, and they know a bit more of the detail for you to get to unpick that. That's okay.
Thank you, Councillor Wheeler. You mentioned KT, so I'm going to bring you in now. Yeah.
Do you want me to come in for my whole bit or just the carers bit?
The afternoon is yours.
Thanks. Just on the carer strategy, we've got a JSNA on carers, big proportion of female carers. We have a strategy which has been in operation for 2 years. We do an annual report on that. There's so much support we need to continue for carers. It's really, really important. And a lot of information about carers that are providing more than 50 hours a week and are often women. I've got some general comments. First of all, I just wanted to say thank you to the public health team for doing this work. I've been personally and professionally really excited about this coming. I think this is the start of a very powerful conversation and some tweaking to our good partnership work. And I think there's some really key themes. So from an adult social care perspective, I'm sitting here thinking about our frailty and falls levels, our increasing dementia levels, etc. And I'm making connections, as lots of us do, to menopause. I'd like us to be talking about perimenopause and menopause, because there are perhaps two phases that we might describe, and different things happening in those phases. And some of that, the differences in the rates of HRT across our county, yet we know the links now between HRT and osteoporosis and some of those things. This feels really fundamental. So I think conversations about that are going to be really important, as well as some of that feeling safe to exercise in your community. And I think particularly in winter when it's dark and not got time, I think there's lots of things for us to think about. Plus the musculoskeletal stuff. I think there's probably some acknowledgement. There's been a lot of pressure in our partnership and possibly acknowledging the journey of mental health support in Nottinghamshire and the impact on women through some of this, and also some of the journey of our maternity services locally. And we know the physical and mental impact of some of that actually will carry on, and that will translate through at some point for some people to other issues that we then see in our system. Some of the carers has already come up, but I'd like to acknowledge also, when I think about the adult social care workforce, it is predominantly female and low paid in terms of our external adult social care workforce, about 23,000 people. and I think it's about 81% female. And the average age would fall into a category around perimenopause, which is just interesting to note. And probably the other thing for me to pull out is the colorectal cancers. I thought that was really interesting. I know that there's a lot of research happening nationally around that, but actually, why is that higher for women in Nottinghamshire than other places? Feels something to understand. And I think acknowledging reducing inequity for some groups in this work is so important, and also acknowledging that a lot of good health research is done on men and then applied to women, and I think you've alluded to some of that, Councillor Doddy. So that's quite a lot of messages, but just in absolute full support of our partnership getting around this report.
Thanks very much indeed. Explanation, actual question. And we just don't have enough cancer screening programs. You've got your cervical cancer, your breast cancer, and your colorectal cancer. So we really only have 3 at the present moment. I've got Councillor Wilmot.
Thank you. I will speak up, Chairman. Obviously, my first thought in the whole system is early intervention, in making sure that people are aware of where to get the help and so forth, because we do have a certain percentage of people that are not on Facebook, not on email, online or anything like that. How can we get that message through to them? You have to remember that there are 7 district councils in this area, and each of them put out messages on a regular basis. So it's essential that we get our act together and make sure that the district councils put these many organisations on their paperwork to make sure that people know about them, to make sure that they've got the opportunity to help. There's so much going off at the moment, and especially the people that women with particular population groups with the English is not their known area, and that's also, we've got to make sure that they are aware of all the help that's possible. And as I say, mental health is another issue. Now, I went to a meeting with about 20 groups there. Many of them I've never heard of before, and one of them was Nottinghamshire Victim Care. So what I did, I walked down my high street and with this pen saying, "Have you heard of Victim Care?" I actually asked 20 women, and about 3 had heard of them. That's a problem. It really serious is a problem, because very often this Victim Care, I'm told by the lady who represented them, that the help that out there is tremendous, but people are not being told about it. And it is very difficult to get all the messages over. So that is absolutely essential. And as I say, we've got to be more proactive in the preventative work and get more talking about smoking. Yet there's more and more vape shops being allowed to open, and people smoking cannabis. We know it's all about. People ringing me up saying next door, smell from it is unbelievable. Can you do something about it? It's simple. I'm very pleased to see the fire service here today. I really am, because them and the police have a big purpose in life. Not only helping the person with the problem that the immediate they've got, and passing on the information where they can get help for the problem that they've got. So, you know, it's essential that we all get together on this. And as I say, if you remember at the last meeting, very last meeting, well, you weren't there, unfortunately, I did say we do need to make sure that everybody is aware of these meetings, to make sure that all help that's possible knows about the situation and how to get the message out there. Thank you.
Thank you, Councillor. We covered a lot of stuff there, but effectively down to making every contact count. And we had programmes whereby all visitors, be they fire brigade or be they police, etc., would be aware of other things that were happening in the house in which they went into, other than the reason that they were called out, with cards to distribute with numbers on them, etc., which have been trialled around the quite a number of the boroughs. I think it's interesting that you say getting through to people and getting them the opportunity to take up things, be that medical care or whatever. We're in the unusual position that to go forward with the NHS and social care, we want to drive, as Vivian McGregor-Riley would say, a remote IT agenda. We want to increase the amount of remote care that we give to people away from physical face-to-face consultations. And the more remote you become, the more people you treat, with the less people you probably actually communicate with. And that's one of the big things that's missing out as a remote. So we're trying to deal with things, high numbers, by doing it remotely, like a physio ringing you up and you talk about musculoskeletal problems. And, you know, a menopausal woman rings up the physio and says she's got a bad back.
I wonder if the director could answer the question, which was, does the director agree that failing to provide literature to other people with different languages will further disadvantage this group of women?
I'm not aware that that's an actual problem at the moment. Any leaflet I see normally has plenty of different languages on it. And in addition, if you look at every single phone that you've got, it's got a translation script on it. So I'm not sure how big a problem that actually is in Nottinghamshire County Council. Councillor Tightwell.
Yeah, Councillor almost right. It's actually targeting specific females, isn't it? The other problem we still find is media is playing a negative effect as well, especially with youngsters. They definitely need a good telling off and need to change their attitude and aptitude. We know that women are financially worse off. Most single family are female, looking after the families, not the men. So there is that negativity from it. Single women, in Broxtowe, we try to highlight areas and get them to go swimming and get them to go to the gyms. The only problem is there's transport connection that we need to look at, because the gyms and the swimming pool are not always available to them because they've not had a chance, can't afford a car, can't spoil their own transport, etc., etc. We know, like maternity at the moment, maternity is actually being run at a deficit. How can you actually improve that when it's been told to run at a deficit? It's absolutely ridiculous. It really is. Both sides are understaffed and also don't have enough finance. And these are where the problems are occurring that we really need to look at, grasp and sort out. We have a responsibility to make sure maternity is fully staffed and fully financially covered, which is an irony actually. So yeah, there is a lot of things that need to be improved for women. Definitely.
Thank you, Councillor Tightwell. I've got one other. Councillor Suddington, were you just asking about the vocals, or did you have a question?
Sorry.
Did you have a question, Councillor Suddington?
Well, really, I think the presentation I'm sorry, I missed your name because I couldn't hear. I think was excellent. I think we all need to take that on board. And also, Chairman, I do welcome the focus on mental health in women. I think it's, I think a lot of people, men as well actually, can sit and not go out for help. And I think they do need to know where they can find help before the problem gets very difficult to solve. And I think that's probably something we need to make people aware of, where they go for help. The GPs are busy, they often can't get an appointment, and therefore where do they go? They don't all have friends that they can turn to, they're not all married or living with somebody, so they can sit at home, feel very lonely, very distressed. And I think we need to make it very clear where people can find help.
It can be fluctuant. Back pain can be there one day and gone the next day. You could have menopausal symptoms one week and less symptoms the next week. So it's not a cumulative end point illness. It's fluctuating. I'm going to take two more people and then I'm going to come back to the director to sum up. Yes.
So I have a question about the report and about how you gathered the data. I just wondered, is there any specific data or considerations given to women from Black and minority ethnic groups, but those that don't have an issue with English as a first language? The reason I ask this is because I'm going to a conference on Saturday, which is all about inequalities in relation to Black and women from Black minority ethnic groups. So I wondered if I can't see anything in the report that specifically refers to that group. And I wondered if there was anything, or if it hadn't actually been that sort of detailed.
So I would say that women from ethnic minority backgrounds were underrepresented in our survey, and so we did interview a few of them as well to try and get some of their voices heard through that. But I would say that that was a limitation of some of our findings, but I think that's probably reflected in many other pieces of council work as well. So I think that's something that we all need to bear in mind when we're doing these pieces of work in the future and hearing those voices equally as well. So I would say that whilst those findings may not be absolutely explicit in this report, they absolutely are experiencing more health inequalities. We know that, for example, maternal deaths are much higher in Black and ethnic minority women. We know that there are significant health inequalities. So, for example, my main area is of sexual health, what I lead on, and we know that there are many ethnic minority women who are late to getting HIV diagnosis, for example, and lots of other inequalities, access to contraception and lots of other things. So absolutely, it is a big challenge, and apologies that it wasn't absolutely explicit in there.
It's fine. I figured that it was there, but I just wanted to check it if we considered. That's really helpful. Thank you.
I'm going to go to Abby.
Thank you.
Thank you.
Thank you, Chairman. First of all, can I say thank you very much for putting this emphasis on women's health in such an important, significant report. I think it's absolutely fantastic, and I congratulate you on producing the video as well, which I think was very accessible and covered a whole range of issues. So I'd like to add my thanks to others for doing that. I'd also like to throw in something which is a little archaic, perhaps. I hope it's not as common anymore, but there is a significant cadre of people who diminish women's symptoms. And when you talk about things like endometriosis, for example, it can still take, and I'm sure that's valid now, decades for women to be diagnosed with what is a excruciatingly painful condition for many and can damage fertility. It's a huge issue and people have hardly spoken about it. And for the most part, women have been told, take paracetamol, go and walk it off, or some other patronising, condescending and ultimately dangerous advice. So there is an attitude issue. Similarly with the menopause and similarly with anxiety, these things get dismissed as being women's problem because it's still there, it's still pervasive in many areas of delivery. And I think that attitude change needs to be a significant part of this. Women do not have a higher health threshold. It's a myth, but you still hear it frequently. Well, women get used to tolerating pain every month. That's fine. You'll be fine. It's just something you have to suck up. It's not fine. And it also affects women's confidence in reporting things if they think they're going to be told it's just a women's thing, suck it up, or you're just being neurotic. And whilst I know things have improved, those attitudes have not gone. And I think this is a fantastic opportunity to address that as well. We can signpost people to all kinds of support networks as long as we're satisfied that those support networks are going to take those concerns seriously. And I think that was implied in some of the input there as well from your video. So can I thank you? And I sincerely hope it will make a significant difference to the delivery of healthcare for women across Nottinghamshire.
Yes, absolutely. I think I did touch on the endometriosis and the fact that it's recognised to be a systemic illness with widespread effect on a lot of the organs of the body, and yet the access to laparoscopy has diminished to the extent it's more like irritable bowel syndrome than it is anything else. I'm going to say that we're coming back to a workshop on all of this, and I think that there's hundreds of more opinions, and they'll all come up in the workshop hopefully, and I'm going to ask Rector of Public Health or her to sum it up for us.
Thank you. Thank
Thank you, Chair, and thank you all for your comments and your really positive support around the board. I've taken down some notes in terms of some of the key areas that we want to address, and we will absolutely make sure that we take those and into those further conversations this afternoon. But I think even from the conversations around the room, we can see that some of the themes in the report are resonating with many individuals across the room. And I think there is something around how do we now move this into action. So, you know, really fantastic piece of work. Really great that we've got such a high level of engagement in the survey, which I think in itself tells us how important this issue around really thinking around how we can support our women in Nottinghamshire to have the best outcomes they possibly can is pertinent to many people. And I think what's really helpful actually is the comment around attitude, and maybe that's something we can think around in terms of we've got the recommendation around hearing women voices. But how do we also support that cultural change within many of the organisations that we work to enable women to feel heard? So, yeah, I won't go on more because we've got time later on, but thank you all for your comments and support. And I look forward to hearing how we can all contribute to improving those outcomes for women in that session.
Thank you, Vivian. Having moved recommendations, all those in favour? Thank you. Now, the next three items are three reports which all lead into our ambition number one, to give every child the best start in life. Since I started here in 2011, every child the best start in life, and it continues to be our ambition to give every child the best start in life. So these three reports feed into each other. Today, particularly 8, 9 and 10, best strategy, how we're delivering them, how we're performing against our ambition number one, and also the infant feeding framework for action. So I'm going to pass over to Lizzie Winter to introduce items 8, 9 and 10. Over to you, Lizzie.
Thank you. I'm going to keep my bit very brief before handing over to Lester. So the Joint Health and Wellbeing Strategy Delivery Report outlines activity against the Joint Health and Wellbeing Strategy within the 2024-25 financial year. And the highlight report in Appendix 1 specifically outlines that activity that's taken place within Quarter 4. The report doesn't seek role activity enabling delivery of the strategy, but just provides support with an overview of activity that would benefit from that greater oversight from the board. I'll take the covering report and Quarter 4 highlight report as read, but just wanted to pull out one new escalation that's been outlined within the report, which is specifically asking for the board to support bringing back an item on making every contact count, the MEC programme in September. This would be specific to undertake a discussion focused on the future and sustainability of the programme, given that public health's leadership of the development phase is due to come to an end in October this year. As per the usual process, the delivery report is a deep dive on a specific strategy ambition. So as you mentioned, this time focusing on ambition 1. I was due to hand over which Matt had to look at, so I'll hand over to Helena Cripps to take us through the deep dive on ambition 1, which, as you've said, Claire, is being presented in combination with items 9 and 10 as well, which are the best starts to refresh and the framework action, in order that board members can undertake a joined up conversation across those three interconnected reports.
Thank you very much. Thank you everyone for having us today. I'm Helena Cripps from Public Health, and with me is Irene from Children's Services, and we've got a few slides. Lizzie, are you happy to share? Thank you very much. But as Councillor Doddy said, this is focused on all things Best Start, linked to ambition 1 of the Health and Wellbeing Board delivery plan, and that is all about giving every child the best chance of maximising their potential. So Best Start in particular is a priority for us, because when we give children a good start in life, it helps them to be healthy and happy, hopefully, across their lives. Thank you. So this presentation is going to highlight the key achievements since we last came to board, which was in September 2024, and also give an update on the progress of the key activities that sit in the delivery plan. and also will introduce the 5-year Best Start strategy in a refreshed version and a new 5-year Nottingham and Nottinghamshire infant feeding framework for action. And we're asking you as a board to consider both of those for endorsement today before they go onwards in terms of their respective governance journeys for formal approval. So these are the 10 ambitions that sit in our current strategy that ran from 2021 to 2025. The idea is that if these 10 ambitions are achieved, children will have the best chance of thriving. Over the next couple of slides, we're just going to pull out a few actions about how the Best Start systems worked over the last year or the last few months to achieve those, just to give you a flavour of some of the work. So on here, ambition 2 is the ambition that focuses on mothers and babies having positive pregnancy outcomes. And just a quick example of a piece of work there is some work that we've done to provide Healthy Start vitamins to pregnant women. So these vitamins are now distributed free of charge across all 3 hospitals in Nottinghamshire to women to cover the duration of their pregnancy. We've also done lots of work to raise awareness of the Healthy Start scheme, which also provides vouchers for people to buy fresh fruit, milk and veg for low-income families. And we've done lots of targeted advertisement and marketing around that and had some really good success with that. Next slide, please, Lizzie. On this one, I'll just pull out in relation to ambition 7, which is all about supporting children and families with early language and speech and communication. And we've delivered drop-ins for parents and carers who might have concerns about their children's speech and language development. And those have been provided in family hubs, in libraries and in health premises. And they give parents access to advice from experts without the need for an appointment. And alongside that, there's also been a new advice line, which again gives parents advice and support they need much easier. And next slide, please, Lizzie. And then on this one, I'll just put out an example from ambition 8, which is about children being ready for nursery and having a good level of overall development. And here there's been a package of training to support children's emotional health and wellbeing that's been commissioned and delivered for early years settings across the county. And that helps early years practitioners to deepen really their understanding of emotional health and wellbeing and learn sort of frameworks and strategies that they can put into practice. So Irene, the next few slides.
Okay, so those of you that have heard me before at this board meeting or know me will understand why I'm presenting this slide. So family hubs have now been launched across all of Nottinghamshire, which I think is a fantastic achievement. We've now got 18 networks across the county. Many of you were at the launch events as well, so thank you for your contributions there. You might spot yourselves in some of those photographs. Got thousands of them. The Family Hub networks, for those of you that don't know, so you may not have heard it, is basically about a partnership. It's local organisations that work with children, young people and families about trying to provide a one-stop shop. So not saying, oh, that's not my problem, you need to go to another service, but actually helping provide that service to that family. So let's make an appointment. I'll go with you to that appointment if you are one of our key underrepresented groups. We've already heard about that today. So there's a lot we can do. We have had some challenges still around family hubs. It was mentioned in some of the progress slides that Helena said, and that's really about our links to maternity services. It's improving, but it's slow, and that's something we are working on about maternity in the community. Next slide, please. The other thing we managed to do is we launched our Best Start for Life offer. We didn't have to do this in Nottinghamshire. Some local authorities received funding to do it. We did it because it's a good idea. We've heard already families are struggling to navigate services. So bringing this Best Start for Life offer together was a key priority for us in the Best Start strategy and health and wellbeing plan. It's widely shared, so there's a hard copy of it. We'll try and bring some to the workshop later on so that you can get to see it. And there's also a digital version, which has got more detail in it. But we're trying desperately to get that out to expectant parents and those with children up to the age of 2. So it says very clearly what services and what you can get. Since we launched it in October, November, wasn't it? It wasn't that long ago. We've already had 3,500 hits just onto the web on the web pages, which is fantastic, and that keeps going up and up and up. Another key priority in our plan as well was to refresh the Best Start strategy. So Helena's already talked about that one. We have now got a new strategy which we are presenting to you today for endorsement. But many of you attended the workshop back in October. It was in the assembly rooms. All of that feedback and other workshops that have taken place have informed the new priorities. We've done some work with fathers, for example, as well to help shape it. And we've also produced a new joint strategic needs assessment about the first 1,001 days. So that's from conception to age 2. So this is the second time we've updated that JSNA chapter, which is fantastic. Next slide, please. Thank you. So the key priorities of our new strategy, refresh that strategy, I should say. Our vision is the same. We want every child to have the best start in life, and we believe that starts from pregnancy. And we need these organisations to work together. It isn't going to work if it's just one organisation on their own. So data and evidence tells us that if we if we give children the best start in life, it helps them to stay safe and healthy and happy throughout their lives. The strategy focuses on early pregnancy to age 5, but has a particular focus on that first 1,001 days. And the idea of this version is to celebrate the work that we can do in building supportive environments for our children and families so that children can really thrive. We have framed the strategy within the building blocks of health. So that was a fantastic introduction earlier. We don't need to repeat that now. And recognising that circumstances, so where you're born and how you're born, it shapes your future. That shouldn't be right. We need to do something about that. Okay, next one, please. So we've identified 5 priority areas. We're not going through this in a lot of detail. You will get the slides. We want to allow more time for discussion. So we will go through, we'll just do a little bit on each of the priorities. But again, we've got to remember the building blocks of health all the way through this. Somebody's not going to access an appointment if they can't access travel. We've said already, they haven't got the money for bus fare. They haven't got childcare to enable them to go to that appointment. So the first big ambition for us then is the building blocks of health. Thank you. Just done that one straight away there, didn't I? So the idea really is, we need to, sorry, Lizzie, just go back a second for me. No, I think that's enough. I think I've covered it in my rambling. Thank you. Sorry. Second ambition, parents' mental health. We know this is a priority, and it's because the evidence tells us that when parents have good mental health, emotional health and wellbeing, their baby or young child is more likely to thrive. I don't think there's any big surprises there. We know that there are low-level mental health issues, and then it can go into postnatal depression and further, throughout the years going forward. We know that we have high levels of mental health need across the county, and we know there's a lot more to do to increase awareness, increase access to services. It's the one thing parents tell us repeatedly: mental health. How do I get support? How do I get it early? And that's always going to be a challenge. The third ambition is around preparing to be parents and healthy beginnings. A lot of this, again, links into some of the building blocks work. Becoming a parent is a big challenge. There's no guidebook. It begins at pregnancy, even before pregnancy. Let's think about what we can do to make sure people have a healthy pregnancy, whether that be smoking, as we've heard already, a range of things that we need to do. If we support parents through this journey, we can really help children have the best start in life. Ambition 4 then, building strong relationships. This is again really important. That's why it's one of our ambitions. We know that babies need a loving, nurturing relationship to support their brain development, their health needs. It supports parental mental health as well. And we need parents to feel confident in raising their child. So we want to have good relationships with organisations. We don't want people to think that service isn't for me. We need to go out, we need to engage our expectant parents and new parents. And also relationships amongst organisations. Like I said before with family hubs, we can only do that with relationships across the organisations. And I have to say a big shout out to the place-based partnerships. I don't think we would have got to some of these priorities without that local action as well. And that includes, obviously, that's the partnerships in those areas. The last ambition is early experiences, chat, play, read and learn. And again, this is another one of my big priorities at the moment. We know that babies learn through interactions with the world. Every smile, every moment of play builds connection in their brain. Parents are the first and most important educator. I think we know that. What are we doing to support those parents? Some people just don't understand that. Some people haven't got the time to do singing, bedtime stories, and all of that. So we need to do a lot more in terms of lifelong learning, get it right in those early years. It's also important to say that despite progress around children's development, we also know that children eligible for free school meals are not likely to achieve those good levels of development that their peers do. So if you are not eligible for free school meals, it's something like 70%. If you are, it's 41%. That is a key priority for us going forward. It's that real targeted focus. When we look then at measuring the impact, we've got a number of indicators. We can track then where we go. We are also developing a data dashboard so that we can all access it across the partnership to find out exactly what the needs are. And then we can then analyse it, do something about it, but share that information. It shouldn't just sit with one organisation. Ultimately, there are a number of measures we will look at. Children's development at age 2.5, the statutory assessment, we will be looking at that data and then tracking them to the age of 4 or 5 when they hit reception year. And that's when we look at the data. It's an assessment led by teachers. We've revamped the Best Start partnership as well, far more strategic than it used to be. We're trying to really get that action and those that senior buy-in. When we get approval, hopefully today, we will then set up a series of task and finish groups to help develop some of this work.
Thank you very much. So I'm going to introduce the draft infant feeding framework for action with a very, very brief reminder of the benefits of breastfeeding, which are benefits for baby, so providing, that absolute optimal nutrition, reducing the risk of some childhood illnesses, benefits for mum, for nursing parent, like some health benefits, reducing the risk of certain types of cancers, and huge benefits to both in terms of building strong emotional bonds that support healthy relationships, healthy child development, and overall, if we can increase breastfeeding rates, we know that plays a role in reducing health inequalities. Breastfeeding status is measured between 6 and 8 weeks after birth. You can see from the graph, Nottinghamshire is the pink line, that it's improving, which is really positive, but we are significantly below the national average, and the other colours are our sort of statistical comparators, our regional and statistical comparators, and we are lagging behind them as well. So you can see it becomes a clear priority for us as a county. So this infant feeding framework for action, which is called Feed Your Way, gives us a really clear system-wide commitment to promote breastfeeding to families across Nottingham and Nottinghamshire. And I just want to be really clear that it is an infant feeding framework for action, not a breastfeeding one, because we're really keen to support parents regardless of the feeding method that they choose. And we want to make sure we provide really good quality supports and services for parents and carers who bottle feed, whether that's with express milk or with formula, and support early nutrition in other ways as well. Thank you. So it's a tripartite framework, so it's led by Nottinghamshire County Council, Nottingham City Council and the ICB, and that's predominantly because of the geography of our health partners working across the patch, so we're really pleased we've been able to do it as a whole system. So it's been developed with lots of engagement with stakeholders and with parents as well. And the drivers behind it are to improve health, reduce health inequalities, which are those unfair differences in health that we've got across the county, and think about tackling the barriers to infant feeding and create an environment that supports parents, whatever their personal choice is. So there are 4 ambitions in the strategy that will help us to do this. That's information and support, choice, data and equity. There is a lot more detail on the specific commitments that we're going to take against each of these in the paper and in the framework itself. I won't go into detail. So I'll move on to some summary slides about everything that we've shared today. We were asked to reflect on any challenges and mitigations, and we think that the Best Start strategy in itself is both our biggest opportunity, but also our biggest challenge. You know, we know that there are pressures across system partners and across services and across the wider system, but we focus the strategy very much on the areas where we know we can work better together. We've narrowed the focus based on what the evidence base tells us. We've narrowed the focus based on what parents and stakeholders have told us is important. And then the implementation is going to be driven by this new Best Start strategic partnership, who will really be driving and implementing the delivery of the strategy. So yeah, we're feeling positive and keen to drive change, and would very much welcome your support with that. And just before I finish, I'll summarise what we have identified as our 5 key priorities for the year ahead. So the first one is to develop those really detailed delivery plans. How are we going to deliver on those 5 priorities we've just told you about? And a lot of that work is already in development. We're going to deliver on the infant feeding framework for action with our partners, in particular in LCB. We're going to develop that dashboard so we can measure progress and impact really clearly. We are going to look at we are going to develop a multimedia library of information for parents, which Irene picked up earlier. And then finally, we're going to develop an e-learning package to help give a wide range of people knowledge about why these 1001 days in particular, from the beginning of pregnancy to 2, are so important, and how we can all play a part in supporting children and families to have the best start in life. So I think that just leaves us to confirm the recommendations to the board, really. So we are recommending that you, if possible, endorse the new Best Start strategy and Feed Your Way, which is the infant feeding framework for action, before it then goes on its onward journey to formal governance. We'd very much welcome your commitment to help us advocate for the Best Start agenda in whatever way you can do that personally, and promote the Best Start for Life offer as widely as you can, and we will bring those limits down. And then today we'd particularly welcome any ideas on how your individual organisation might be able to support us in delivering the strategy, bearing in mind that it's about creating the right conditions within which our children and our families can thrive, and championing the role that everyone can play in that. Yeah, thank you very much.
Thanks very much indeed. Yes, it's an enormously comprehensive presentation. Fantastic. To follow on from what you said, that before we go to a vote, I move to recommendations on page 42, 97 and 123. It reminds me back in the 1990s when Sure Start centres were first introduced, and we had families and mothers and children going to centres which contained all of the people there that they needed to help them. Were enormously successful. I'm sorry, Sue, you want me to speak up a little bit? Yes, they grew to 3,500. Every professor that ever existed in history said that children thrived. There was less obesity, less non-accidental injury, higher breastfeeding, deepened conduct disorder, best school preparation, better mother-child mental and physical health. So we know what works, and we're now starting to slowly replace it with the family hubs, etc. Having had it once and let it disappear, we're now bringing it back again. I think that's excellent. It'll be very interesting to see the enormous explosion in ADHD and autism, how much of that can be improved through going back to this best start in life. When I first looked at the JSNAs and things like autism and neurodevelopmental disorders, it was 10% in girls and 2% in boys. And now people talk about up to 25%, so it's been quite incredible. So we're hoping that will be the main byproduct of giving every child that start in life. Did you have your hand up, Sue?
I did, Chairman.
Councillor Saddington, over to you.
Right, well, thank you for that report. Thank you to you both. I would just like to say my thanks to the former Cabinet Member for Children and Families, which of course was the former Councillor Tracy Taylor, who set up and worked with the Children and Families Department to bring these 18 hubs to fruition in places where they are needed most. And what what I would say is it covers from maternity to after the birth of the child, and there is a high percentage of people who are using them. So I would ask that this administration continues them and continues to establish more should it be necessary, because they are used. It is somewhere for people to go for advice and help. And if we need any more in areas of need, then I hope this administration will look at it and work along and get them done. Basically, Chairman.
I think that it's a tried and tested model. To say it's a reflection of Sure Start. It just happens to extend from 0 to 19 instead of what that did. We know how wonderfully successful they were, and I'm sure that they're only going to be good. There's going to be no retraction of the enormous work done by Tracy Taylor and the team and Colin, etc. And the fantastic work that's been done around that, and we recognise it and welcome it, and hope it actually grows more and more and more. We probably had 50 to 70 Sure Start centres. We've got what now, 17 hubs or something like that. There's a lot of potential there.
Separate points.
Yes.
So my first one is, as a physiotherapist by background, I was really pleased to see the perinatal health floor service that's been established. Is that a recurrent service now? Because looking back to the last item, often it's the start of gynecological or musculoskeletal problems in women.
Yes, my understanding is it's been established by the ICB. It's part of a huge drive from NHS England, and they're delivering in lots of different locations, so health settings, but also family hubs and accessible venues as well.
And then just a couple of other points. So thank you for the acknowledgement of place-based partnerships around family hubs. I think also within that, just to acknowledge the community development workers within what were the children's centres and the relationship they have within the communities and how they've been a really key asset in building that. And then just the final point in terms of support, I've got a meeting on Friday with Deborah Neal, who is the inequalities midwife lead from Nottingham University Hospitals with UNA. So they acknowledge they're doing a lot of work within the city, but haven't really done as much within the county. So that's exciting.
Thank you. Yes, it's a remarkable overlap between this interest and the Director of Public Health and Women's Health. Giving every child the best start in life overlaps with giving every mother the best start in life. And we've overlapped mental health, and we've overlapped physical health and physiotherapy, and we've overlapped smoking and pregnancy, etc. And there's an enormous overlap between, which is a good moment to bring in the Director of Public Health.
And you picked up exactly what some of the things I was going to say there. So thank you for that. So I think it's really nice to have these two things working together, and there's a tremendous amount of work that's been done and continues to be done around Best Start and really improving our outcomes for children. And so I want to say thank you for the work and also the collaboration across the teams, because I think there's a really strong collaboration. I'm really keen to build on that. As you were mentioning, there are a lot of reoccurring themes that we're hearing today. So really keen to think around how do we take some of these conversations forward and really think around how we do. So as you mentioned, mental health, having services that don't feel right for people. So some of that question around access, and also some things around how particular vulnerable groups are disadvantaged. So in your particular case, you're talking about those that are eligible for free school meals. So really thinking around how we pull out some of those equity lenses on them. So thank you for that. I've got a couple of specifics, if I may. One was around your multimedia library, and really keen to think around how we absolutely need to have services for Best Start and young people, but also linking them into the broader Making Every Contact Count approach and community directory. So really keen to think around how we're linking those up, and we can have conversations offline to think about how we do that. And then my other question was around the training package that you talked about, Best Start, and I wasn't clear whether that was for staff or for parents.
Apologies, it's for staff, for a wide range of professionals. So anybody who comes in contact with family who could have an influence, and it's aligned to the MEC approach. So the idea is that it will build on that MEC healthy conversations approach and always be like a package that would then sit well as a second package to do.
thank you for that clarification. So I'd be really keen when we have hopefully some further conversations around MEC, around how we can take that forward within our organisations. But I would also be interested to know around how we're supporting parents to understand how important those first 1,001 days are, because we know that, but not many people do if they don't work in the field. So just a question around that. If I may come back just very briefly, yeah, exactly that, supporting parents with the information, advice and support that they need is a huge part of the Best Start strategy, and that's why we want to work differently with a much wider range of partners and people who parents connect with regularly, and make much better use of the brilliant national resources that are already out there that are really fantastic and have come along in recent years. So yeah, thank you.
It will be part of the community directory as well.
Thank you. Just a quick question. You spoke about breastfeeding initiation being lower in the municipal. Do we have an understanding of why that is? And is that something that we can actually address through this strategy?
Thank you. Breastfeeding generally is lower in areas of greater deprivation. So we see that mirrored in our districts that are more deprived. And generally, there's a misconception, I think, that breastfeeding is natural and therefore it's easy and it's intuitive, whereas in reality, the majority of women experience difficulties and challenges with it. So there's something about preparing women for that, but there's a lot about women then having the support that they need exactly when they need it, and making sure we can connect people to the support. And it's often within that first week after birth, so it's really quite quickly that you are.
So talking to somebody that I used to be in midwife and would tell women those things, oh, it's natural, it's easy, but then when I tried to do it, it wasn't. So yeah, that's a really important point. So thank you. I'm glad that you think
personalised care is a huge part of that. So understanding what individual people's aspirations are around feeding and then supporting them with that.
Expectations as well, isn't it? Thank you. Thank you, Chair.
Thank you. Thank you. I'm going to take three more and then we'll sum up. Councillor Wilmot. Thank you very much, Chairman. It is really fantastic that to read the examples of how people have been helped with the development of their children. You know, it really is. And it must be noted that every case is different, of course. Every case is different. And I was particularly pleased to read the comments from a resident from Hong Kong who said that our services have been a great help to them, to their family. But can the director advise how we overcome the language barrier in such cases? The next point, I'm just looking at all the four ambitions, great ambitions, tremendous work that's need to be done though, you know, really is. The first one, as I say, giving every child the best chance of maximising the potential. It's essential that bullying is stamped out in our schools. This will stop much of the stress that some of our children are seeing at the present time. I go into schools and I am told about it and I tell the head teacher, of course. But again, what can you do when you've got 1,500 pupils? What can be done about it, the situation? Well, something's got to be done about it. But we have got to look into that situation and help the schools in that way. As I say, when they are bullied, if it's stamped out, it will enable the child to obtain a better education and feel safe in their environment. It is also essential that everyone has the opportunity to visit outdoor recreational areas. Absolutely essential, that is. And that's why there must be a cost thought to the people that can't afford these situations. Everybody must be given the opportunity. And we know that how much help is needed out there. Leisure centres and libraries, you know, must be advertised more. They're there to help. They're to educate our people, and it does help in the stress level, getting the stress levels down in all the population, whether it's children or elder. I was wondering how the new children's hubs situation is progressing. I was at the one in Nottingham when it opened, and there were so many organisations there. It was unbelievable. And I thought to myself, well, if everybody gets involved, you know, there's got to be an improvement. I just wondered,
is there any work that you can say to them that there has been a substantial improvement in that? Now, the other issue, the final one, is the youth justice system. They're doing such a lot of work, but are we involved in it? Are we getting to know these poor old children that need help? And they do need help, even though that some of them are so-and-sos, you know, at times, but they do need help. How can we get that help out to them? Are we working with the youth justice system as we should be working with the police and the fire service as well, and all the opportunities to get involved with everyone? So I just wondered the possibility of that. What's gone off?
Yep, quite a lot there, Councillor Wilmot. You talked about wonderful ambitions, but
I have, yeah.
Ambitions should be wonderful. Having one is not wonderful. And you touched quite a bit there, really, on resilience. You're talking about when kids go to school and there's an element of bullying, etc. What is it that differentiates the kid?
Have we got a way forward?
Have we got a way forward? How do you build resilience? By giving every child the best start in life, giving them a secure home, giving them somebody to come home to, who actually picks them up when they fall, so that leaving mobile phones at home and not bringing them into school would be an exceptionally good thing to do.
I think so, yeah.
It's the core part of most children stay in terms of bullying and harassment, etc. I'm going to ask if anybody wants to pick up on any of the other issues. Irene.
I'll try and do this briefly because I know I'm worried about time. So the first point was about overcoming language barriers. So certainly in our services, we do get as many things translated as possible. New languages come up all the time, so so we do that. But also the other thing that we do in family hubs, but also other teams as well, is we recruit peer supporters and volunteers from particular target groups. So the Hong Kong example you've given, that parent is now a volunteer working in our building. So that's about trying to get local champions and so on. I won't cover bullying in schools because I think the chair's covered that one. In terms of financial help and advertising services, we can't do our work without supporting all those issues around cost of living. So in our early help services in Nottinghamshire, we have 3 dedicated DWP, Department of Work and Pensions advisors working with our families. Just in fact, at one of the launch events, they had a stall there, a parent came and that parent left, suddenly signed up to 3 new benefits that they didn't even know they were eligible for. So straight away that kind of lifted that family. So I suppose that's one of the examples. It's that joint work and not worrying about, oh, well, they're not in the building so they can't support. It's that picking up the phone. Youth justice as well, very, very important that we focus on early help with that. So it is again linked to resilience, but also that family network. Colin's about to answer that one, I can tell.
Well, that's a good time to stop then, Irene. Thanks very much. So I'm going to take 2 more speakers. I'm going to take Councillor Tideswell and Colin. I'm going to leave you to the end, Colin, because you might be able to even answer Councillor Tideswell's question. For one, Councillor Tideswell, over to you.
Right, just a quick question. If I was, say, a parent to be, would I go to Best Start, Sure Start or Family Hub? It seems confusing to me.
Same thing. Yeah, people.
Well, why can we not call them one thing so everybody knows what they are?
Originally, they were called Sure Start. That was a national programme, and that term was mandated. Everybody had to call them Sure Start. Then there was a national change of direction, and they were called children's centres. Then there was further change in national direction, and now they're called family hubs. If you talk to somebody on the street, they would probably still call it Sure Start, whether they had kids or not at the time. And people then say, oh, you closed Sure Start. In Nottinghamshire, we carried it on. We just had to follow the national guidance in terms of names. But I do appreciate there is confusion.
And the family hubs you go to are in the Sure Start Centre.
Yeah, exactly. But why do we
the building is exactly the same.
Confuse everybody. You know, a young person getting pregnant for the first time, a young family, and we'll do it. Where do I go? Get confusion out of it.
It has fundamental differences in the scale of the services that it offers. It's like a super duper thing, but it is confusing because the same centres to provide the new service. Colin, the last word with you.
So I was just going to respond with regards to Youth Justice Service. Yeah, and I'm, as Director of Children's Services, delighted to say that we've received a letter from the Ministry of Justice, from one of the deputy directors, about a scheme called Turnaround. So we were funded to work with children who are on the cusp of offending, for a 3-year period starting in 2023. So the programme's still going on. And we were given a target of 226 children to work with. We did work with 226 children. 2 years in, we worked with 338 children to date. Staff of Nottinghamshire YGS has since been recognised in a letter by Alan Webster, Deputy Director within the MOJ, who led on Turnaround for their exceptional performance across the programme. Alan goes on to state, "This is a great achievement, a reflection of your dedication, professionalism and commitment to improving outcomes for children and their families. Your efforts have not only met but exceeded expectations on what the programme can achieve. The national programme has shown that for children who complete the interventions, only 7% go on to offend in the following year. In Nottinghamshire, this translates into fewer victims and increased safety in our communities. So not only has it changed the child's life, but actually in terms of the community's position, it's changed it too. Importantly, the Committee Preventative Work continues through the YGS's My Future Youth Support Programme, alongside the Services Diversion Bureau. We're doing really well in Nottinghamshire on this YGS.
Doing really well. Yes, I like the sound of that. Thank you, Colin. I'm going to move to recommendations and thank Irene and Lena. We could talk about it all day. Thank you both very much. All those in favour? Thanks very much. Conscious of the time, and I'm going to move on to all of our favourite subjects, the better care. Who's going to talk about the better care? Oh. I'm going to introduce this first and foremost by saying that this is for ratification rather than for discussion, and it's our statutory duty to present this to people rather than actually elucidating steps.
Hi everybody, I'm Anna Oliver, so I'm Group Manager for Adult Social Care Commissioning. I know we've got a few new people, so just as a bit of an introduction, just a little bit about our Better Care Fund. So the Better Care Fund is a way for us to pool budgets between the NHS, so our ICB, and our local authority. The aim of that is to commission a range of services that are person-centred across the system to support people, improve outcomes, tackle those inequalities we've been hearing about all afternoon, enhance productivity, but also to deliver those through value for money. Some examples of this is our work around supporting people to be discharged from hospitals, so making sure those pathways are correct for people, and our support to our carers, and also our prevention offer, so how we prevent people's needs escalating, prevent them getting into hospital in the first place, work with lots of those other things that we've heard about over the course of the afternoon. We are required to submit an annual plan as well as quarterly reporting around the fund, so how we're going to use it and how we are using it. We are set a series of KPIs around there, so we've only got 4 KPIs for this. We have just submitted our Q4 return, and in that Q4 return we are meeting 2 of our targets. So our admissions into hospital, our avoidable admissions, and the people being admitted due to a fall, so we're meeting those targets. We are slightly off target for our admissions into residential care homes. We are aware of that, and it's something that we are working on across the department. It is an area of focus. We are also slightly off for people coming out of hospital and being discharged back to their usual place of residence, but we are monitoring that locally. Local data would show us we are much closer to our target. We're keeping a close eye on that so we can work on that when we need to and see a change there. The annual plan was also submitted at the end of March, and as part of that planning process, we have been working across the ICB and County Council to look at the services that we are purchasing through our BCF, and to look at how we review those services, do things better jointly, make sure they're fit for purpose and how they're working. So we have a plan for that over the coming year. And as part of that, what we discussed with the previous board was about how when anything comes through for programmes of work, you're receiving regular updates, we let you know when it is BCF funded, so you're aware of what we're doing and how that's coming forwards, rather than feeding you lots and lots of things because there's a lot of lines on that plan. We've also planned to hold a workshop later in the year to get board members involved in that planning for next year, so you can really feed in, be part of that planning process and really impact what we're doing going forward. So we've got that planned for later in the year. What we did decide with the previous board was that the reports that are going to come forward to the board will be at a higher level, letting you know about the fund, and we'll give you the bits from those workshops.
I'm Naomi Robinson, I'm Deputy Head of Joint Commissioning in the ICB, so thank you, Anna, that's a really good overview. And I think just to reiterate that, the narrative plan and the national requirements are all very closely aligned with the integrated care strategy, which is another document and strategy development that is fully engaged with this board. So you'd expect to see that alongside the Better Care Fund in the coming year for a fresh engagement.
So our ask of the board is that we ratify those submissions that were made for and also plan.
Yes, as in the recommendations of page 107, that ratify the Better Care Fund and submitted to NH England and to Nottingham ICB obligated, delegated decisions, etc. And thank please it's a big sum of money, £128 million. And the only thing I can comment on is that the residential admissions that you said to be aware of, that the number of people moving into long-term care is above what you would like it to be. It probably is no surprise to anybody with an ageing population. There's probably no surprise to people with people who are etc. That there would be an increase in that use. How on earth do you keep it down as opposed to wonder that it's actually gone up?
We're doing lots of work on how we support people in their own homes, in their communities, through our home care market, so providing support to people in their homes, but also looking at other forms of support. So communities where we can support people to live well within their communities, looking at what we might need from our extra care going forward so that people still have their own front door, their own independence. So we're doing a big review piece on what those other options might look like. But we are seeing an increase in people using home care, a decrease in residential, although it's not quite to the rate that we want it to be at. So we are starting to see a slight change there.
And how much technology is contributing to
You want to, like Katie, got your hand up?
Yeah, we've got a really clear technology-enabled care strategy. Almost 50% of adults that draw on care and support, we've got about 13,000 people long-term adult social care support. Almost 50% have some sort of technology as part of their support. And that's anything from that comfort of being able to call somebody through to monitoring systems. They don't film you, but monitoring systems to understand your patterns in your home and therefore give very accurate information to families so that people don't prematurely go into a residential care home. We have got so much information and positive stories of difference of people themselves saying, I feel so much more confident to stay at home. I don't want to go into a care home now. I've had this and this technology to support me. And we know from a carer survey nearly 2 years ago that we'll probably repeat soon, 89% reduction in carers' anxiety and stress with technology in the home. So, and Nottinghamshire is at the forefront nationally of use of technology.
When you say 50% have got some technology, 50% of what population?
50% of adults who draw on care and support, so adult social care.
Who are known to us.
Yes.
And yet there's an enormous amount of people out there who use it because the family buy it. Together there's a Christmas present or something like that, and they monitor you on the phone. It's extraordinary when families show you that they can do it around the house. So that is the future.
It's the future. We've all got kit in our homes that we don't fully use as well, haven't we? There's a lot of potential.
Fantastic. Okay, I move to recommendations. All those in favour? Excellent. We are now at 2:45, so we're almost spot on. we just have to make of the work programme, which is item number 12. James, do you mention the work programme?
Thank you, Chairman. So, as I say, we've got the work programme displayed in there, and as the dates that are in there have yet to be confirmed by council. So, once those dates are confirmed, they will go into the invites and a couple of terms of content.
September.
Yes, please.
I'll just briefly run through some. For September, we've got the next quarterly health and wellbeing strategy report and Better Care Fund performance reporting. We've also got an item on joint strategic leaders work programme as the process to prioritise topics for 25-26 is currently open and due to come forward for approval. As mentioned earlier in the meeting, we've also got a proposed item around the future of Making Everything to Account programme. An item on the Refresh Children's and Young People Mental Health Transformation Plan, and also an item on the Families First Partnership Programme, following your comment at the last meeting, Colin, that the board could have a role in putting into the plans for the programmes that are developed. But always welcome input from partners around the table, obviously regarding proposed future items that are
Yes, thank you very much. And I move recommendations on 66. All those in favour? Excellent. And before people go, I'm going to go back to Councillor Saddington over there. How many people actually felt that they heard most of what we were discussing today? Did anybody have a problem with hearing? So it's largely a right-sided problem. If we just move you all over to that other side, I think that would probably do it.
Or move you across into the
middle. Or move me. Yes, that's probably better.
Perhaps we could have a proper system like there used to be here.
There was, yes.
Yes, my understanding is that reading the Evening Post, that the current administration has decided that they continue to use County Hall. I don't know whether that's true. And if they are, the current administration have decided to continue to use County Hall, then perhaps we can put the system back and solve the issue.
I think that is a very desirable outcome. And we used to have microphones in here.
Yes.
And I think we're just playing a game by pretending that we can just speak and it'll all be fine. We're trying to, it's like the emperor's new clothes, really, isn't it?
There's also disability access and things related to not having it, which I think is quite a serious issue.
I think we need to bite the bullet and either put in the microphones or get a room that's appropriate to properly communicate.
It does disenfranchise people if they've got particular issues. So,
enormously, and I'm enormously aware of that. Did you hand up at least we did just Councillor Wilmot.
What you just said about being heard, you would have been heard much better if you'd been at the head of the tables.
Absolutely.
Yeah.
That's the position you should have been.
Like an umpire in one of them chairs.
No, yeah. It would have.
I think there could not better. I think that what you're saying is that if we had a row close there and we were directing
everybody would have heard
downwards. Possibly.
Councillor Doddy, could I just make the point that if we are going to be using this room for the next meeting, that obviously we're still trialling different formats for how we try out with this room or any others. So it is something that we Democratic Services will work with. Yeah.
Good point. It's only the camera that actually stops us being there, I think, because we would have our back to it. But other than that, yeah.
I think your tables are low enough. You would have seen that too.
Yes. Or could we have been up at the top end over there, perhaps?
Yeah, we did.
I like it. Good idea. So fantastic. We can talk about it over coffee and biscuits, custard creams, which are now available in the assembly rooms. Thanks very much. Thank you.